So let's talk about your hip pain and that pesky glut tendonitis. It can affect anyone 18 to 87 years old, according to research, but on average, it happens 54 to 63. Women are more likely to have it than men, and of course, that age range shows us that hormones are involved. Women have a wider Q angle than men, so their pelvis is wider, and so the tension that is placed on the tendon is greater. So let's take a look at this article that is exercise-based interventions for glut tendinopathy. So you have glut tendinopathy if you report symptoms are worse with activities of daily living, such as walking, climbing stairs, sitting and getting up from a chair, and of course, being on that side. So putting pressure on that side. Basically using that glute muscle to fire and move the hip causes you pain. And it can come on slow, but it can also come on very fast. I have had women walk into Target fine and leave Target limping, barely able to walk. It can come on that hot and fast. If it's not a full thickness or partial thickness glute med tear and it's just actual tendonitis, exercise does help. Let me show you. The exercise intervention will be to actually strengthen the muscle that is giving you issues, your hip abductors, your abductors. The way we heal tendonitis in people who are not young athletes is not so much plyometrics, but more eccentric strengthening. Now here's something that I know and I want you to understand. Don't be afraid to move your hip. So in this particular research study, yes, they did eccentric strengthening of the hip abductors, but the results also included weightlifting. And so they want you to know that strengthening is very, very important. And the resistance exercises helps. And it is possible that you are going to feel more confident and strong and less worried about your pain and less catastrophizing thoughts. Fear avoidance behaviors are very, very real, and that is because glute pain is very, very real. With every step you're taking, it's hurting, so you eventually become afraid. It actually makes sense because when you look at how long hip tendonitis lasts when you don't treat it, 5 years. 5 years. Now, I know you're watching this. You're not going to wait 5 years to do something. So we've established that you need to lift. We established that you need to strengthen your hip, providing it is not a partial or full thickness tear, because that's different. We're talking about tendinopathy only. But let's look at one more study that talks about menopausal hormone therapy in postmenopausal women with greater trochanteric pain syndrome. Now, I don't love the verbiage of greater trochanteric pain syndrome, but let's get past that. A majority of these are going to be glut tendinopathy. So this study states a positive association between high estrogen levels and tendon health may exist. And postmenopausal women have reduced estrogen. Menopausal hormone therapy may reduce the incidence of tendon abnormality, particularly when combined with exercise. So they randomized people to groups. They did tendon-specific or sham exercise. All groups received education about avoiding glute tendon compression and load management throughout the 12 weeks of intervention. I also like that this assessment that they use, the Victorian Institute of Sport Assessment for Gluteal Tendinopathy, so a VISA-G, and they looked at these measures, and here's the results. The hormone therapy group with exercise and education had a significantly better VISA-G outcome. So menopause hormone therapy combined with placebo or tendon-specific or sham exercises plus education reduced pain. Hormone therapy alone reduced pain and increased function for postmenopausal females. So a targeted exercise or sham exercise strategy is effective when prescribed with education about avoiding gluteal tendon compression and load management. So educating women on how to not abnormally or excessively load the tendon, healthy habits, good posturing, not hanging on your hips, and hormone therapy worked. So I've shown you 2 articles, one that shows hormones work, one that shows education works, one that shows exercise works, whether it is resistance training or specific. And I want you to take these 2 articles together and say, what I do matters. Your hormones matter. Your activities of daily living and the habits you do during the day. So stop hanging out on that one leg. Strengthening matters. Everything that you do matters. So you can make change.